Methodist Specialty Transplant Hospital is the only hospital in the world that has transplant in it.
We are not only the best in Texas, we are also the best in the nation in terms of getting excellent results in terms of outcome.
Liver Clinic, this is Teresa. How can I help you?
It's very common for patients to drive 4 to 6 hours to come and see us.
We'll be right with you, okay?
When I first started having symptoms, I didn't know what was wrong with me. It's just felt weakness.
He's an unfortunate patient that had multiple bleeds from gastric varices. These are varicose veins that happen due to liver disease in the stomach.
It wouldn't stop bleeding. I wouldn't stop bleeding. It just kept bleeding.
This is an ideal candidate for an injection therapy called cyanoacrylate injection, which is, in lay terms, is called the glue injection. Glue is a substance that you inject into these varicose veins with an endoscopic procedure, and then it hardens to form a clot.
Nobody helped. Nobody could help. When I got to this hospital, they found what was wrong with me, and they corrected it. They fixed it, and I'm doing great.
We have a very talented group of people, and it works as a multidisciplinary approach, and all of us have the same thing in mind, is extraordinary patient care so they can get the best outcomes possible.
What struck me about the Texas Transplant Institute was the unique setup where the surgeons and the hepatologists work very closely together. In most institutes, there's 2 separate services and they tend to work independently with some overlap. But here we round on our inpatient service together. We're often in clinic together. We make decisions together.
I round with the hepatologist on all of the liver failure patients, liver disease patients, liver tumor patients, and liver transplant patients every day, 7 days a week. And so the continuity of care, I think, makes the biggest difference in the results that we've had. Our 1-year survival over the last really about 8 years is about 95%, with the average across the country being about 85 to 90 over that period of time. And the 3-year survival is run mostly between 87 and 92%, with the average being somewhere between 78 and 80.
We have a selection committee meeting once a week, so any patient who completed their transplant workup is being presented there. It's not uncommon that when we first present, we say, unfortunately, this patient may not be the right person to place on the list at this moment. And then we say, this and this and this are the issues, and we come up with a plan on how to work on those issues to rectify them.
There's a lot of, I would say, old school techniques such as venous bypass, which are not used by many centers, but it allows us to preserve the organ, I think, in a unique way, in the sense that while we're sewing the liver in, we can pack the liver in ice and keep it so there's essentially no warm ischemia. And because we can do that, the venous bypass machine has a heat exchanger, and therefore we can take our time, sew it in, and have the liver to work immediately afterwards.
Texas has one of the highest incidences of liver cancer across the country. When they say everything is bigger in Texas, that certainly applies to liver tumors. We meet once a week where we review our patients' imaging and we try and reach consensus on what the best way to treat them is. So this Liver Tumor Consortium is a group of physicians that works together. It includes the transplant surgeons, it includes general surgeons who have an interest in solid organ tumors, it includes hepatologists, diagnostic radiologists, interventional radiologists, and oncologists.
Well, they have taken and given me a new liver. They have given me new time.
But he's really an example of the triumph of medicine and surgery in this realm of liver disease. Until now, it's probably the biggest problem in liver transplantation is control of hepatitis C.
I don't have none of those things today. The hepatitis never came back. I don't have cirrhosis, and I got a brand new liver.
The chance to take care of something that was hopeless now is not hopeless at all.
Methodist Hospital does save lives, and I'm living an example of that.